actually happened completely by accident. I was just coming off a stint in hospital where they discovered I had diabetes, and during the course of getting that sorted out, there was a lot of testing done, and one of the things that showed up was a low testosterone level, which the doctors and the endocrinologists weren't really worried about, but I was. I followed that up in my own time with a test day clinic in Sydney, and they came back and said, yes, you do need some sort of treatment, but there's a formality test first, which is a PSA. It's basically an androgen that's secreted by your prostate. There's a certain level that's supposed to be secreted on a regular basis, and if your reading goes high, then you have an issue that needs investigating, not necessarily cancer, but steps are to be taken. And that's literally how we found it, quite by accident. We weren't looking for it. There was no symptoms whatsoever, none at all. I actually asked my GP to give me a referral to a urologist. I did my research, I asked around, I found out who I wanted to see, and I spoke to him for the first time. He gave me a digital exam, which was literally over in the blink of an eye. Sat me down, told me exactly what was going on, said straight up I had an aggressive, fast-acting cancer and it was going to need surgery as quick as possible. I think until I actually walked out of the urologist's office, after having just been told, yes, you've got an aggressive cancer, it was all a bit surreal. It wasn't going to be me. It was going to be some sort of paperwork glitch or something that wasn't serious. And then in my case, because it was a fast-acting cancer, things happened so fast that it didn't really have time to sink in until I was actually on the table. And then it's all in someone else's hands. It's all in the lap of the gods, I suppose. And I had what they call a radical prostectomy, which in my case, they cut you open basically from the belly button to the little file and take out prostate, lymph nodes, a few other bits and pieces that you don't need. And the idea is that if they get it all with the surgery, then there is no radiation therapy afterwards. I think the biggest problem we've got with men and their attitudes to their health is there's this big stigma about nobody's putting their finger in my bum. The fact is, it's a blood test. PSA test will tell you whether you're normal, which is a big relief, or whether there's something that needs investigating. It's really not a complicated formula. Once you hit about 40 years of age, get a blood test every 12 months and keep yourself in reasonably good condition. That helps an awful lot when it comes to having surgery, and not just prostate cancer, anything at all. If you're in good shape, you're going to handle the surgery better, you're going to handle whatever sickness better, and you're going to recover quicker. My ride in DGR last year didn't happen. It's pretty ironic because all the people were gearing up and getting excited about going for the ride, and I was actually being diagnosed with prostate cancer and getting told, you may not be riding for a long time. But this year I'm going to make up for it. I think it's a good ride. It's just a little bit different, a little bit quirky. And it gets its message across in a great way. I'm 8 months out of the surgery now. I've had 2 follow-up checks and I'm reading 0. So if I get that for another 2 years, I'm clear.